These are some things not to say, and I've heard counselors say this when you're working with somebody, and particularly we're talking about post-infidelity stress disorder. So somebody who's been betrayed, they're traumatized by this betrayal. It just goes with it that you're going to be traumatized once you discover. So the first thing not to say if you're a mental health professional, if you're working with somebody with PISD, post-infidelity stress disorder, or you're working with a couple, is it was a long time ago, let it go. First of all, the point of discovery is what really matters, and they could have discovered this 20 years after it happened, and that is the traumatic part. So clients decide when they're going to let that go or how they're going to let that go, and that's always a gradual, long, rocky road, kind of roller coaster process. You just need to move on. We may feel like saying that, but this can be something that's so traumatic that it's very hard to move on, and hearing this is not very helpful. People need to process this and work on this. And yes, maybe time heals. Again, as we've discussed before, time can heal if there's been a confession. If there's not, and it was just really highly suspected and a lot of evidence and all that kind of stuff, this could go on forever, and people may never get over it. They're never going to get over it, but will the heat and the trauma of it subside? We don't know. Okay, so we don't need to say this is hurtful. That the affair or that the partner had the affair because it's a symptom of a larger relationship problem. Maybe, maybe not. This is a common one that you'll read about and hear about. Maybe or maybe not. It could have just been that this person maybe had too much to drink and was in the wrong place at the wrong time and just did it without thinking. That actually doesn't happen. There's thought and choice that goes into it. So that the clients get to decide if there's a larger relationship problem, and I wouldn't let the betrayed blame themselves. As an experienced counselor I was talking to not long ago about this issue, he's got 20 years experience with this. She goes, there's never a good reason to cheat on your partner. There's 1,000 things they could have done differently. So no, it doesn't have to be a larger relationship problem. Emotional and physical affair is the same thing. No. The client gets to decide if that's the case. For some people, an emotional affair may be very traumatic. For some, the physical affair is far more traumatic. Clients decide this. So it's not going to be uncommon. One of the common things that you can tell is if somebody has been betrayed, is for the betrayer to blame the other person, and an emotional affair is common to use. So you actually, that's almost a little bit of a sign to keep in mind, that if somebody says, well, I know you really like so-and-so, that can be a sign that that person is trying to divert attention away. So just be aware that emotional and physical affair, the clients get to decide whether that's the same thing and what's worse or more or anything. Both partners played a role. This is kind of similar to the symptom of the larger relationship problem. No, it may not have been the case at all that both partners played a role. This is something I've heard and I've read, and just be aware that that does not have to be the case. So just be aware, as mental health professionals helping these people with the trauma of betrayal, that we don't say things that are very hurtful, such as this.